Hey, it's Dr. Allin here at Evolve Chiropractic in Woodstock. Today we're going to be talking about vitamin D. As we go into the winter months, that beautiful sunshine that we love to hang out in starts to go bye-bye. So what do we do in these scenarios where we're not able to get enough sun exposure to give our bodies enough vitamin D to keep our bodies functioning at the optimal level? So typically what we're going to end up doing is some form of supplementation. Now, if you look up online, a lot of numbers are going to be all over the place as far as how much to supplement, what the benefits are of vitamin D, if vitamin D even helps. So we're going to try to break this down as clearly and as concisely as possible so that you'll know exactly what to do come these winter months. So the best way I like to break down vitamin D is to compare it between D3, which is our active form of vitamin D, and D2, which is commonly found in our food sources. So foods like eggs, fish, cod liver oil, my personal favorite. All those things have pretty high levels of vitamin D2. Now the problem with D2 is that the body has to take this in, it has to convert it and do all these different biochemical conversions to turn it into D3, where now your body is able to utilize it and it can do what it's supposed to. So ideally, what we want to try to do is either get vitamin D from the sun or supplement with an active form of vitamin D, which is D3. As far as the benefits of vitamin D, not just the one that most of us know about, the mental health form. So if you think about seasonal affective disorder, or SAD, as the sun goes away, we tend to get into deep, low, depressive type moods. Anxiety, bipolar disorder, Alzheimer's, all these mental health dysfunctions have been shown via research that supplementing with vitamin D3 can greatly improve these issues. So if you know that you kind of get down in the dumps when the sun goes bye-bye, start supplementing with vitamin D3 as soon as possible, and that'll get you through those winter months. The other one that we can look at is weight management. If you're having difficulty shedding those extra few pounds, supplementing with vitamin D3 can actually boost metabolism and help you start to burn fat a little bit more effectively. Bone strength, this is a big one. Vitamin D3, it's not necessarily a vitamin per se, but it's more of a hormone. And what it can actually do is assist in the process of many different functions in the body, but one big one is bone strength. So vitamin D helps to bring calcium into the system. And in our bones, if we have enough calcium and phosphorus and vitamin K, those bones will be very strong. So using vitamin D3 will help to boost your body's ability to bring in calcium and store it into the bones. Combining that with something like vitamin K2 will greatly help the absorption and the ability to build those bones nice and strong. Yeah, next one we want to look at, which during this time of the year, a lot of us are getting colds and flus and all those crazy things. Immune function. So vitamin D3 from the form, or in terms of like a antiviral protocol, D3 will actually help stop the replication of certain viruses. So making sure that your levels are optimal is very important during these months where we're more prone to get viral infections because they're flying everywhere. Kids are back in school, back into the work areas, and just everything's getting stirred around. We want to make sure that our body is able to fight these viruses as effectively as possible. Now, as far as dosage is concerned, if you look at the RDA's recommended daily average or your allowance, you're looking at 600 IUs per day. What most research has shown is that this isn't very therapeutic as far as the dosage is concerned. Now, if you have very low levels in your bloodstream. Now with vitamin D, it's extremely important to get this checked before you start supplementing, because vitamin D is what we call a fat-soluble vitamin. So it can be toxic at high levels for long periods of time. And most commonly what will happen is that if you have too much vitamin D in your system, now your calcium levels are going to go way up. And if calcium levels go up, you could end up having problems with your heart, and many other issues that we really don't want to have come up. So make sure that you get this tested at your doctor. It's a very common blood test that's done now to make sure where your levels are of active vitamin D3, and then you'll know how to dose appropriately. You can do higher doses, but typically a maintenance dose for most adults is anywhere between 2,000 and 5,000 IUs per day. Again, it sounds like a lot compared to here, but what research shows is that you need that therapeutic dose to maintain a certain level of vitamin D3. I've seen studies as high as 20,000 to 50,000 IUs for a short period of time to bump the blood levels back up, and then they lower them down to a maintenance dose around that 2,000 to 5,000 IUs per day. So hopefully this helps out. I know as the winter months are starting to come in, we're starting to go back into our shells a little bit, but rest assured that if we make sure our vitamin D3 levels are adequate, your body will be functioning much better, you'll be feeling much better, and it'll make those winter months much easier to get through. So if you have any questions, concerns, feel free to reach me here at the office. Be safe, have fun, get at it. I'll see you soon.